If you are starting tamoxifen therapy for breast cancer and you want to learn more about this medication, then this video is for you. In this video, we are going to discuss what tamoxifen is, its mechanism of action, the dosing and administration instructions, proper storage and handling, and the adverse events that you may experience while on tamoxifen and how to manage them. What is tamoxifen for? Tamoxifen is used as adjuvant treatment of early-stage estrogen receptor positive breast cancer. Tamoxifen is a selective estrogen receptor modifier, or SERM. It competitively binds the estrogen receptor and blocks estrogen from binding. This decreases tumor size and delays tumors from spreading. Now we are going to discuss how to dose and administer tamoxifen. Tamoxifen is an oral tablet and the dose is 20 milligrams daily. You can take with or without food, but make sure to take it at the same time every day. Swallow the tablet whole with water and do not break, chew, or crush the tablet. If you miss a dose, skip it. Do not take 2 doses at the same time to make up for the missed dose. Now we are going to discuss how to properly store and handle tamoxifen. Tamoxifen should be stored at room temperature in a dry location away from light and excessive heat. Keep tamoxifen in its original bottle or in a separate pill box. Do not mix other medications into the same pill box as tamoxifen. Make sure to wash your hands before and after handling tamoxifen. If someone else will be handling your tamoxifen, have them wear gloves so they do not come in contact with the medication. Keep tamoxifen out of reach of children and pets. Now we are going to discuss some adverse events that you may experience while taking tamoxifen and how to manage them. Hot flashes are a common side effect that many women experience while taking tamoxifen. To manage hot flashes, you can do non-pharmacologic interventions such as regular exercise, avoiding or limiting caffeine, spicy foods, and alcohol, and staying in a cool environment or using a fan. Some pharmacologic interventions for hot flashes include gabapentin, venlafaxine, and clonidine medications. According to the American Cancer Society, the risk of developing endometrial cancer from tamoxifen is low, but uterine malignancies have been reported with tamoxifen use. The recommendation is to have an annual gynecologic assessment if you have a uterus. If you do not have a uterus, then you do not have to worry about this risk. Thromboembolic events, such as deep vein thrombosis and pulmonary embolisms, have also been reported with tamoxifen use. No DVT prophylaxis is required, but you can reduce your risk of developing a blood clot by regularly exercising, drinking plenty of water to stay hydrated, eating a balanced diet and keeping a healthy weight, and moving around regularly while on long-haul flights or lengthy car rides. If you do develop a blood clot, you will likely be treated with anticoagulants. Tamoxifen has been known to cause eye problems including dryness, irritation, cataracts, and deposits in the retina. The recommendation is a yearly eye exam by your eye doctor. Some people may also experience fluid retention or swelling. To manage this, you want to avoid standing for long periods of time, keep your legs elevated while sitting or lying down, avoid tight-fitting shoes and clothes, avoid salty foods, and monitor your weight regularly. If you experience vaginal itching, dryness, or discharge while on tamoxifen, you can manage this by using a vaginal moisturizer 2 to 3 times a week, using lubricant during sexual activity, and wearing a pad when you have discharge. Now we are going to discuss some additional warnings or precautions with tamoxifen therapy, such as drug interactions and reproductive concerns. Listed on the screen, you can see some common medications that have drug interactions with tamoxifen. These include antidepressants such as bupropion, duloxetine, fluoxetine, and paroxetine, and an anticoagulant called warfarin. Always talk with your treatment team or pharmacist before you start any new medications or supplements while on tamoxifen therapy. Tamoxifen can cause fetal harm, so patients who may become pregnant should use effective non-hormonal contraception or condoms during tamoxifen therapy and for at least 2 months after the last dose of tamoxifen. And these are the resources that I referred to during my presentation. Thank you for watching.